Hello everyone. Today's topic is syphilis. Syphilis is a type of sexually transmitted disease or a venereal disease caused by spirochete. Spirochete is a bacteria. So, the type of spirochete called Treponema pallidum will cause the disease. The Treponema pallidum, as in the figure, it is a helically coiled bacteria of Spirochaete family. It is usually of 6 to 15 micrometer long, and it can easily be destroyed by cold, heat and antiseptics, and it cannot be visualized by usual gram staining method. So it can be demonstrated with some advanced techniques like dark ground illumination and fluorescent antibody techniques, etc. The main method of transmission or mode of transmission in the syphilis primarily is like any other sexually transmitted disease, it is unprotected sexual intercourse. And the other methods are direct contact with the lesion, that is, the person with the syphilis may have lesions in the skin, lips, and the tongues. So, if there is a close person to person contact directly with the lesion, then there is a chance of transmission of the organism. And the other thing is transfusion of infected blood. And the fourth is mother to fetus transmission, that is the transplacental route of transmission. So the babies or the children who are born with the syphilis, which is acquired from their mother, is called congenital syphilis. Okay, so the congenital syphilis is the mother to fetus transmission, and the other three route will cause the acquired syphilis. Okay, so there are congenital syphilis and acquired syphilis. While coming to the acquired syphilis, there are three stages in acquired syphilis. The stages is like the person who are exposed to a bacteria or a infection, then he will develop first thing the primary syphilis within 3 weeks. Then he will upon improper treatment he will develop into secondary, he develop the secondary syphilis, and then later he will develop the tertiary syphilis without proper treatment. Okay, so the primary syphilis is characterized by the presence of chancre. Chancre is actually an ulceration or a painless papule with a central ulceration. Okay, painless papule with a central ulceration. It is actually self-limiting, that is, it heals without scarring even in the absence of treatment. So it mainly appears on the genitals or at extragenital sites. Genitals means on the penis or in the vagina or the cervix, and extragenital means mainly on the throat or lips or tongue and on the skin within 2 to 4 weeks after the exposure to infections. Okay, so if a person is exposed to the infection, then he will develop this chancre within 2 to 4 weeks. Okay, so that is the primary syphilis. So if that exudate from the lesion is cultured or is observed under the microscope, then we can find the Treponema pallidum. Usually the antibody test in this primary syphilis stage is positive. Okay, so then if there is an improper treatment, or the patient who with primary syphilis are improperly treated with the drugs, then within 2 to 3 months he could develop into secondary syphilis characterized by mucocutaneous lesions and painless lymphadenopathy. Painless lymphadenopathy means the lymph glands will be swollen but painless. Okay, mucocutaneous lesions means the lesions in the skin and the mucus glands. Okay, so that will be on mouth, pharynx and the vagina usually. And also generalized skin eruptions will be there, that is, the skin will be eroded like in the picture. So the general ulcerations will be in the foot, hands and all. So the antibody tests are always positive in the secondary syphilis, and it is a highly infective stage. That is, if the lesion is come into contact with a person, another person who is healthy, then the mycobacteria, the microbes can be transmitted to that person. Okay, and tertiary syphilis means during the secondary syphilis, either the microbes or the bacteria will end up in an inactive period. Okay, that is they will remain in an inactive period or a latent period where they won't invade any other tissue, just multiply within that limit. They won't invade or disseminate into all part of the body. They will be just in that lesion itself. That is called the latent period. But latent period of secondary syphilis, upon 2 to 3 years, the bacteria will take 2 to 3 years. After 2 to 3 years, they will cause an active infection. That is, this bacteria will disseminate throughout the body. That is, they will attack or invade all the internal organs, including neurons, heart, blood vessels, etc. Okay, so within 2 to 3 years, this bacteria, after the latent period of secondary syphilis, after maintaining the latent period, they will cause the infection. So these lesions can be visualized in almost all part of the internal organs like blood vessels, aorta. Blood vessels means mainly they will attack the aorta, and also the neurons, brain, meninges, etc., lungs, liver and all. So this is actually a less infective. That is, in this tertiary syphilis, they cannot spread infection to other healthy persons. Okay, because the lesions are in the internal organs. So it is a less infective stage. It cannot spread the bacteria outside the body or to an healthy person. So it is actually a complicated one because the organ failure can happen in the tertiary syphilis. So the criteria or the characteristics of the tertiary syphilis are, there can be two types of lesions. One is syphilitic gumma and the next is diffuse lesions. That is, diffuse lesions means the lesions in throughout all the body. So that mainly manifests in the heart, that is the cardiovascular system, and the neuronal like the nervous system. That is called in the cardiovascular system, it's called the cardiovascular syphilis, and the next is the neurosyphilis. So the syphilitic gumma is like the name indicates, it's like gum like lesions, that is the rubbery lesions. Okay, so solitary localized rubbery lesions will be seen with central necrosis, and it is seen in the liver, testis, bone, brain, etc. So in the liver it is called the heparobolatum. Okay, so the cardiovascular syphilis mainly happens in the aortic wall. Okay, so the wall of the aorta is weakened and dilated like in the picture, and also there is a failure of aortic valve. Okay, aortic valve. In the neurosyphilis, it can invade the neurons, especially the meninges. Okay, so it will end up in causing meningovascular syphilis, that is syphilis in the meninges, and tabes dorsalis. Tabes dorsalis is a condition which can affect the spinal cord. Okay, the spinal cord can be affected. General paresis in the brain, that affects the brain. Okay, it affects the brain so that it can cause the general paresis or weakening of the whole body. Okay, general paresis, the weakening of the whole body. So this is the thing as a whole. The Treponema pallidum spread to various organ and even CNS. So within 2 to 3 weeks of infection, it can cause a primary syphilis, and the characteristic feature of primary syphilis is a chancre, and it can heal without treatment. After 2 to 12 weeks, then it can, if there is an improper treatment, it can develop into a secondary syphilis. And secondary syphilis, there is a generalized lymph node enlargement, and fever will be there, sore throat will be there, and mucal, that is the mucocutaneous patches will be there. That is the patches in the mouth, throat, vagina, etc. So then the bacteria can go into a latent period where there is no infection, or where there is inactive period. Then within 2 to 3 years, 28% of the patient can go into tertiary syphilis, where it can develop into a systemic complications. That is the complications in the cardiovascular system, neurological manifestations, and the gumma. Gumma is a rubbery lesions in all the organs like testis, liver, etc. Okay, So this is the thing about the syphilis as a whole. Now the congenital syphilis is that the baby, that is the the baby who is born with the syphilis, who acquired the infection from his or her mother, and the actually that is called the congenital syphilis. So this may develop in a fetus or of more than 16 weeks gestation, that is the 4 months gestation, who is exposed to maternal spirochetemia. Maternal spirochetemia means maternal blood which is filled with the or loaded with the Treponema pallidum. Okay, so the features of the babies who are born with the congenital syphilis is saddle shaped nose. Saddle shaped nose means the flattened nose due to the damage or destruction of the nasal bridge or nasal septum. Okay, that is nasal bone will be damaged, so the babies will be a flat nose or will have flat nose or saddle shaped nose. And other features are Hutchinson teeth. Hutchinson teeth means the permanent teeth of the baby will be peg shaped. Peg, okay, peg shaped teeth. And bony lesions will be there, that is the bone will be affected in the babies. Interstitial keratitis will be there. Keratitis means the opacity, corneal opacity will be there, that is the vision will be affected, eyes will be affected, or the ophthalmological manifestations is called the will be there. So that is called the interstitial keratitis. And diffuse fibrosis will be there, that is the parenchymal organs, that is the internal organs like liver, lungs and all will have fibrosis. Fibrosis means the normal parenchyma of the lungs, liver etc will be converted to fibrous tissues or non-functional tissues. So these are the features of the congenital syphilis. Okay, so these are the things about the syphilis. Hope you understood the topic. If you have any doubts, please ask me. So, and that's it. Thank you so much.